Hey, welcome to the PTCB Prep Guide. This is your place to learn all things pharmacy, but in simple, clear language. We're all about breaking things down one concept at a time so you don't just remember the information, you actually understand it. Because let's be real learning happens when you know the why and the how, not just a bunch of random words on a flashcard.
So if you're studying for the pharmacy tech exam, does this feel familiar? You're just drowning in a sea of flashcards, trying to cram, hundreds of drug names into your brain. It is super stressful, it's exhausting, and honestly, it's just not the best way to get ready for the test or for the actual job.
So, what's the secret? What's the better way? It's really all about shifting your mindset. You see, passing the PTCB isn't about winning a trivia game. It's about learning how to think like a real pharmacy technician. The exam, and way more importantly, the job, is going to ask you to apply what you know in real-world situations to keep patients safe. Okay, let's look at a perfect example of what I mean. A flashcard might just ask, what is lisinopril? That's just a simple recall question. But the real exam is going to give you a scenario, something like this. A patient develops a dry cough after starting a new blood pressure medication. Which medication is most likely responsible? See the difference? One tests memory, the other tests your understanding.
So, how in the world are you supposed to know the answer to that just from a single flashcard? Well, you can't. If all you memorize was lisinopril is for blood pressure, you're totally stuck. But here's the good news. There is a much smarter way to figure this out, and it doesn't involve memorizing every single side effect for every single drug out there.
Here's how you solve it by actually understanding the concepts. First, you just identify a pattern. You notice that a lot of medication names end in pril. They're all in the same family. Second, you connect the why. You know that these are ACE inhibitors, and they're used to lower blood pressure. And third, you recall the how. You remember that one key fact about this entire class of drugs is that a common side effect is a dry cough. And just like that, the answer becomes obvious. See, it's not about memorization, it's about connecting the dots.
And that right there brings us to the absolute core of studying smarter, learning to see the power of patterns. This is how you go from being totally overwhelmed by hundreds of drugs to confidently understanding entire categories of medications all at once.
Just take a look at this. By learning these 5 common drug endings, you've basically unlocked the function of dozens and dozens of medications. Knowing that anything ending in statin is for high cholesterol is so much more powerful than trying to memorize atorvastatin, simvastatin, and rosuvastatin as 3 totally separate things. This is literally the definition of studying smarter, not harder. And this is really the bottom line. The path of just memorizing facts on the left? It's a jumbled mess. You forget things fast, it's confusing, and it just leads to a ton of test anxiety. But the path of understanding concepts on the right, it's a straight line. It's logical, the knowledge actually sticks with you, and it helps you nail those tricky scenario questions. Most importantly, it builds real, lasting confidence. And that's exactly our goal here, to be your guide on that clear path. We're here to help you build that true, deep understanding, so you're not just cramming for one single test. I really want this to sink in for a second. You're not training to be a robot who can just spit out drug names. You're training to become a competent, safe, and confident pharmacy technician. You're preparing for a super important role in healthcare where patients are going to rely on you. And that all starts with understanding, not just memorizing. The key is to break all this complex stuff down into smaller, manageable pieces. So what we do is simplify drug classes, break down pharmacy math so it's actually easy, explain the laws in plain English, and walk you through practice questions step by step so you can see exactly how all these concepts work in action. Our entire philosophy really just boils down to these 2 words, learn smarter. It's not about how many hours you cram, it's about giving you the right tools to build a solid foundation of knowledge, one that's going to serve you on exam day and for your entire career.
Okay, so let's talk about your path forward from here, because this isn't just about studying, right? It's about building a brand new skill and stepping into a new career with total confidence.
And I want you to remember this every single time you sit down to study. You are capable of this. You are building a real, valuable skill. Every single concept you truly get, every aha moment you have, it brings you one step closer to your goal. Thanks so much for learning with the PTCB Prep Guide. Remember, real pharmacy success comes from understanding concepts, not just memorizing terms. If this helped you see a smarter way to study, give this a like. And if you have any questions or other topics you want us to break down, just leave them in the comments below. And don't forget to subscribe. Let's master pharmacy together.